What does informed consent for carbamazepine, otherwise known as Tegretol, look like? My name is Dr. Sutton. I'm a board-certified adult psychiatrist, and I talk a lot in this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing when clinically appropriate. And I've been going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. So today we're talking about carbamazepine. So carbamazepine was originally developed as an anti-seizure medication, but it has since gained some other FDA indications, including bipolar mania, as well as trigeminal neuralgia, which is a neurologic condition where you basically have acute neuropathic pain in your face. There are also a number of off-label uses, including things like other neuropathic pain, bipolar disorder maintenance, alcohol withdrawal syndrome, behavioral issues, as well as impulse control disorders. So in psychiatry, when we're talking about carbamazepine, we're primarily talking about its use in bipolar disorder. I do generally find that it's pretty well tolerated. Of course, there are a few side effects we're going to warn people about, things like stomach upset, fatigue, dizziness, headache, blurred vision, dry mouth. Sometimes people can have fluid retention, causing them to gain weight, and sometimes be minor skin changes like a rash. However, in rare cases, there can also be Stevens-Johnson syndrome, which is a very dangerous rash and a medical emergency. This would be one of the more severe adverse effects that we warn patients about. Others include causing issues with your blood counts, which can lead to bleeding disorders. There can also be liver injury, as well as hyponatremia, where your sodium levels go low. So for this reason, it is important that we monitor your complete blood count as well as comprehensive metabolic panel. Sometimes this can cause an irregular heartbeat, and we're also going to warn patients about the risk of SI with this medication. Other things to consider with this medication is that it's not safe to take in pregnancy. It also interacts with oral contraceptive pills, and so it may make them less effective. So generally, I'm not recommending taking this medication in young women who may be having children, but if you are, it's important to have multiple forms of birth control and a barrier method. So that brings me to the other major issue, which is that there are a lot of potential drug interactions. So I'm certainly not going to go through the full list here, but it includes things like I said, oral contraceptives, as well as warfarin, which is a blood thinner, and multiple different anti-epileptics, some SSRIs, some antibiotics and antifungal medications, HIV medications, some cancer medications, and more. Also, there can be some food interactions. So for example, grapefruit is going to interact with the carbamazepine by significantly raising the level of carbamazepine in your system, which increases the risk of toxicity. So this is certainly not going to be a first-line agent for me for bipolar disorder, but if people have failed other options or not tolerated them, then it could be worth considering. One of the things I think about when making this decision is how many other medications the patient is on. If the patient is on a lot of other medications, then I'm probably going to steer clear of this medication due to all those interactions. If there's another psychiatric medication that you want to hear me go through the informed consent process for, then please put it in the comments below. I'm also putting together an email list for those of you who are interested in my content, because I may have future courses or offerings and I want to be able to communicate directly with you all about those things. So if that's you, send me a DM with your email and I'll see you in the next one.